Good afternoon. I'm Dr. Lori Dewald from the Department of Health Education and Promotion at Walden University. And along with me are three of my graduate students. We have Stefanie Bollheimer, Stefanie Popper, and Holly Reese. They are all graduate students in health education and promotion at Walden. And today we're talking graduate level teaching and learning. And the objectives of our session today are to understand how course assignments fit into the learning objectives and into accreditation standards. And we are also going to have a reflection from the students on course assignments and the determining of the value of these assignments in the development of their professional knowledge, skills, and abilities. And so, as we begin, I'd like to talk a little bit about graduate teaching and learning research. It doesn't take me long to talk about this because there's not a whole lot of research in the area of graduate teaching and learning. There is tremendous amounts of research in undergraduate learning and also in undergraduate teaching techniques, especially in the health education and promotion fields. There's some research on learning at the master's level and some research on master's teaching techniques, but not much. And then when we get to the doctoral level of teaching and learning, there's no research. There's absolutely no research on teaching and learning at the doctoral level or on even teaching techniques at the doctoral level. So with that, we are going to begin those discussions here today. And we know that graduate student learning at the master's and doctoral level in health education promotion have at least one course and preferably two courses in the basic principles in health education and promotion. But unfortunately, we have a lot of graduate programs at the master's and doctoral level who do not have those entry-level courses that establish the framework for those professional fields. In the many years ago, we often would have students who would go from undergraduate, then they'd go to a master's degree program in the same academic field, and then eventually they'd go to a doctoral program in the same academic field. So the undergraduate programs were preparing them with those basic foundations, but we're not seeing that anymore. And so we need to see that information. We need to get those students educated in the basic principles. Some examples are in the dimensions of health and the difference actually between health and wellness, because there is a difference. There's philosophical differences, but we also need to educate our students into what health is. Unfortunately, a lot of graduate students come into master's and doctoral programs thinking that health is obesity and diabetes. And when you ask them to do an assignment, all they think about is, they can't even think for themselves to think of another topic. So diabetes and obesity pops in. And we need to expand their knowledge. And the way to expand that knowledge is by preparing them in the basic foundations in one or two courses. Some additional foundations that we need to prepare our graduate students in include the differences in health and wellness, and they need to know the spectrum of nutrition and how to apply it. They need to know mental health and all of the different types of mental illness that we have and how to achieve mental wellness. We also need them to understand and be able to apply the cycles of abuse and the power and control wheel. These are some of the basic foundations, plus all of the philosophical foundations that we have in health education. If we prepare them in one or two courses, in their first quarter, in their graduate programs, they will be better prepared for the rest of their coursework, because they will be able to expand their knowledge in every single assignment. And so we understand accreditation. This slide shows accreditation from the top down. There's university accreditation all the way down to the accreditation of undergraduate programs and everything in between. We also, here is a chart that demonstrates graduate degrees and master's or doctoral graduate degrees. It explains the coursework, the purposes, the courses, course objectives, and then it filters down to course assignments. The ultimate goal is for all the course assignments to fit into that particular course's course objectives. The course fits into the purpose fits into the graduate program, and ultimately into accreditation. And we know that instructional scaffolding is a process by which the teacher, or in this case, the faculty, add supports to the students that enhance their learning and aid in their mastery. This can be done in many different ways, but one of the hallmark ways that it is done is through feedback. Also, we know that the graduate level course assignments shouldn't just be something that's thrown together, but instead it needs to be very closely aligned with the learning objectives for the course. And every assignment needs to have a rationale. Why are you having the students do these assignments? And what are they learning from it? And how is it enhancing them as future professionals? We also need to understand how course assignments fit into their long-term learning, and into their professional marketplace. We also need to understand that course assignments have to ultimately fit into the accreditation standards of that graduate program, of that school. In any case, it could be the School of Public Health, and ultimately into the university accreditation standards. A few moments ago, I mentioned feedback, and feedback is critical at all levels, but it is especially critical at the graduate level, because students at the graduate level are receiving feedback, so they are ultimately learning how to give feedback by receiving feedback. So when they go out into academia, they will know how to give feedback. And so we, have recorded feedback is kind of a trend lately. And that's ultimately fine for the short term. But if the course by chance is delivered electronically through a learning management system, that feedback disappears when the course disappears off of the student's records. So written feedback really and truly represents long-term feedback, because the students can actually return to that document at any time and revisit the feedback, learn from it, remember it, and actually sometimes see the feedback through a new learning lens. And with that, what I would like to do now is I would like to turn this over to our graduate students. Our first graduate student is Stefanie Bollheimer, and she will be talking about how students approach the assignment, how she learned from that assignment, and the value of feedback. So with that, here is Stefanie Bollheimer.
Now that I'm unmuted.
That's all right.
Dr. D. I'm here to share with you today my experience as a graduate student and to highlight some of the more impactful and beneficial assignments throughout my online health education and promotion degree. In the early stages as a graduate student, I was extremely intimidated, as many are. I was embarking on a complete career change from a long career in hospitality towards a career in health education. They are two completely different fields, of course, but at that time, I didn't know how much they were actually so similar. I was constantly worried I wasn't going to be up to par, as I had yet to learn how to channel all of my experience as a service industry professional into strengths rather than seeing them as barriers. One of the ongoing requirements for online school is to submit a weekly discussion post. I was actually terrified to contribute to the discussions at first with people who I had felt had way more experience in the health education field, and I would never be able to compete in that arena. But little did I know, more than a few of us felt the same way, which over time we built relationships and were able to support each other throughout these discussions. I was able to create a positive tool out of my discussions by strengthening my ability to communicate and relate to diverse groups of people through each course. The discussions also help build my self-confidence, my self-efficacy, and my ability to maintain the needed time management skills. The discussions also helped me to learn that I have something to contribute through the feedback of my professors and also my peers. I also learned how to organize my thoughts in a way to form strong research questions, plan my approach, and to determine valuable and reliable literature for analysis while conducting extensive hours of secondary research each week. One of the most beneficial assignments for me to speak of is during the program, the beginning stages, we were assigned to take a Gallup personality strengths and weakness assessment. Prior to taking this assessment, I had yet to decipher how to even contribute my own personality characteristics or my past experiences into this degree. I had a science degree previously, and to me, health and science were connected, but not officially. The benefit of assessing my personal strengths and personality themes allowed me to determine my study style. I understood that I was an intellectual, so I needed to think a little bit longer than others did. Usually I would look ahead to see the assignments so that I could ponder them for long periods of time. And all that was laid out in my Gallup group themes. So it showed me that what I thought was a weakness was actually a strength. And I could revert back to these assessments as I did to speak with you today to reinvigorate my understanding of myself. I learned how to channel all of these traits and productively brainstorm, strengthen my planning, and execute all the ideas that were circling in my head in an organized manner and concise and professionally. Thank you.
All right, our next student is Stefanie Popper.
Hello, thank you for inviting me to participate and provide some input into the subject of graduate level teaching and learning. My name is Stefanie Popper, and I'm a recent graduate of the Master's of Science in Health Education Promotion program. And prior to this, I had attempted other health administration or health education programs, public health, that were a little more complicated, and I didn't quite know how to effectively navigate the online forum. I'd never been a distance learner before, and I found something so simple as reading all the directions available became critically important to the learning process. So clear, concise, or course discussions or assignments became extremely useful and beneficial to me as a student. I read and reread every direction that was there because I did question myself as to whether I was understanding the requirements for each discussion and assignment and what the instructor wanted. I think a large part of our struggle starts with the idea of, as a student, of completing this class with a good grade. And then we take into the consideration the idea of meeting the instructor's expectations. And maybe we look into truly understanding the course requirements and really try to grasp how the course assignments might fit into the learning objectives and how the value of the class assignments may provide to developing in our professional capacity. So taking that back it goes all the way back to reading first and then adjusting our thought process as graduate students. Circling back to the important yet simple thought of just reading the directions, yes, it's critical to the student's success. However, also really important is the clarity of the directions. Oftentimes throughout the class and the program itself, I found myself again rereading the assignment directions and asking myself, what did the instructor mean? What exactly is the instructor looking for? Eventually, I learned that, or really understood that the instructor has already crossed this bridge as a student and is thinking on a different level. And I learned to look at the directions in a different way. The instructor is thinking on the instructor level, and though that did help to elevate my thought process, it truly did. I spent a lot of time, again, rereading, rethinking, and questioning my work. Instructors are thinking of the process of public health from a public health educator view, which is wide and expansive, whereas I, as a student, was looking at things from the assignment and class view, which was very narrow and more targeted. So bringing those two views together required adjustments on my instructor's end and on my end, very much so, because that's where I grew. From a growth aspect, the advantage always goes to the student, but it's very helpful when the instructor can see things from the student's point of view, if only for a moment. For an example, one assignment addressed the benefits of primary and secondary resources and the differences, and then reviewing the different articles, differentiating whether they're primary or secondary resources. Now looking back, I can't imagine why this was so complicated for me and why I had spent so much time researching the subject. But I think having some more definitive explanations on the assignment and subsequent assignments helped to quiet my anxiety and help me to see the bigger picture rather than focusing on one part of the assignment and the class. In this particular class, I was not extremely successful on my first assignment. I reached out to the instructor, and though I hopefully wasn't rude, I was quite frank about not understanding the assignment requirements. And though I had read and reread all the directions, I remember asking the instructor, well, how was I supposed to know that? I did not see that anywhere in the directions. Thankfully, the instructor was very kind and, more importantly, listened, I believe, with the student's needs in mind. And the instructor returned to the concerns I expressed. I was able to keep me focused, was able to help me navigate the assignment requirements in a more comprehensive way. By that, I grew as a student, I grew in my thought process. It helped me to see things more spherically and more in line with what my future goals were. But what was most helpful is the instructor taking my concerns, using them to benefit the entire class. The instructor implemented more directions, clear directions, samples, examples of what was expected throughout the class. My vision changed and my ability to look ahead to how each assignment moving forward will fit into my goals of the class, but as a whole and as a professional. It also positively affected my enthusiasm for the class and the learning objectives, and opened my thoughts on practical application and utilization of what I had learned in the class. In fact, I was able to implement some of this instructor's directions, examples, and supplemental aids in other classes moving forward. It really helped to elevate my thoughts to the graduate level and also in practical application in health education and as an educator. Another instructor provided video responses. These were helpful, though they were short, they were student directed, they were individualized. I'm sure that took a lot of time on the instructor's part. Unfortunately, we weren't able to return to these for the longevity of the class and after the class. So as a side note, the idea of clarity in directions and expectations for international students, this might also be really beneficial for them. I didn't start my education in the United States, and I know the feeling of uncertainty as you try to understand the objectives, especially if English isn't the primary language. and the learning standards may differ. So the clarity of directions for each assignment in every class really goes a long way. Thank you.
And our third presenter is Holly Reese.
Hello, I'm happy to be a part of this SOPHE conference. Before I talk about my first assignment, I'd like to mention that being a doctoral graduate student is very different from being an undergraduate. As an undergraduate, I didn't know myself, I hadn't found my passion, and I was just focused on graduating with a degree and hopefully getting a job. But enrolling in a graduate program was a choice, directed by my discovered life passion for the public health field, and in particular, the older adult population group. In making this choice, I want quality instruction. I want to advance myself. I don't want an easy instructor. I want an instructor who will help me reach the highest levels in my field where I can successfully affect positive social change. I want to make a difference. To that end, how have my assignments at Walden University helped me to fulfill my goals? Well, the first assignment I'm going to talk about was a final project that I completed for a course entitled Assessing Community Health Needs. And the final project was to actually put together a complete community health needs assessment for an actual local community. And this was a fun project. Completing an entire community health needs assessment in 1 week, which is the normal assignment time frame, is a bit of a stretch. So this project, thankfully, involved combining the work from 3 assignments that each contained some of the components of the entire needs assessment. I feel this approach works really well in learning smaller pieces and then putting it all together as the course progresses and seeing how it all fits into a final project and how you would apply these skills in real life as a health educator. I was excited to have the latitude to not only choose a local community, but also to choose the target population group of my choice, which was older adults. This choice allowed me to collect and generate resources that may be relevant for my upcoming dissertation, which I consider to be a valuable bonus. By allowing this choice of a community I'm familiar with, the assignment provided personal relevance and engaged me completely. The project started with a detailed description of the community and target population group, and along with the overarching goals of a participatory community health needs assessment. And while the assignment didn't have us perform interviews and surveys, it did call for collecting some primary data using a windshield survey, which was very enlightening in getting a feel for the community. And primary and secondary research data was then examined to identify priority health needs. We evaluated community resources that I discovered through online research and visiting the community itself, evaluating those resources for strengths and weaknesses. And the project also involved identifying and describing methods to communicate and then disseminate the results of the assessment to the local community with an eye for motivating their support for the intervention that would later be created. I found this project to be thought-provoking, an invaluable learning experience, as well as fun. And this was a lengthy and time-consuming project that required an efficient and organized approach to complete it on time. From the beginning, I developed an outline of the project as a whole, which was aided very much by the description provided in the class assignment that covered each of the 3 components of the project, along with the final desired layout. In my outline, I identified for myself what I need to do and when to complete each of the 3 components of the project. And I found the weekly reading assignments and resources to be extremely well selected to provide me with the relevant knowledge and information I needed to complete each particular phase of the project that was due. For each project component in a given week, I acquainted myself with the scope of the component, then read the learning resources with the project needs in the back of my mind, making notes referring to useful pieces in the learning resources. Then I went back to the current project component, wrote a more detailed outline, conducted my research, and fleshed out my outline until it became the completed project component. I found this to be a really successful methodology. Then the instructor feedback that I received from each component was invaluable in letting me know that I understood the project and I was progressing along the right track. The feedback was specific, useful, and always framed in a positive light. The feedback let me know if I was on the right track, what was working and what wasn't, and allowed me to improve my work in each successive component. Now, I really want to stress the value of receiving feedback from instructors that tells you what is working, what isn't, and where I need to focus to improve not only my weaknesses, but also my strengths. The feedback that I felt was lacking was the feedback from the final finished project. I received high praise for the work I did on the project, but there were no recommendations for areas where I could improve upon or guidance on how to be a better writer. I would have greatly appreciated receiving some advice for improvements to work on as a scholar practitioner moving forward. Thank you.
And so, as you can see from the 3 students, they have a wide variety of perspectives, but most importantly, they have some great ideas for encouraging graduate student education and graduate learning. So with that, we are going to go through the 3 students again. So we are returning to Stefanie Bollheimer.
Thank you, Dr. D. For this section, I'm going to share with you my perspectives of professor feedback and a little bit about one of my most important assignments that I've ever created. The feedback from professors is very imperative. It's an imperative aspect to the success of all students, especially us graduate students. We want to know, what are we doing right? What are we doing wrong? How can we be better? There is a difference between stating great paper or grammar or you need to be more concise. Well, where do I need to be more concise? How can I limit my words and still be as concise as needed? These are the things that will help us grow. Instead of students work from benefiting the detailed feedback, we are going to have to look further into, already presented research. So it's easier and more beneficial to receive that feedback from your professor. Oftentimes the feedback received is able to stretch our thinking, confirm our direction, making sure we're headed in the right direction, or if we need to kind of jump ship and start over. If this idea is rich enough to contribute to a substantial program that would be supported in real life in the community. We need to bend our thinking a bit more, and all of that comes with the support of our professors and our peers, of course. One example that I want to share with you is how professor feedback helped me through detailed brainstorming with one of my professors. I was able to channel my years of hospitality experience that I shared with you earlier into a passion to help others. I created a health and wellness program that I was extremely proud of. What I perceived as a barrier was actually a success because I had life experience with a group or a population of people who experience high rates of alcoholism and addictions and depression and mental illness. And as I conducted my research in this realm, I realized there isn't a lot of support systems that are out there for this type of population of people who struggle. The program Tips to Wellness was developed to research and understand an industry. It was also a wellness program that could be implemented into different restaurants, different types, small and large. It would support the physical and mental wellness of these employees while creating an environment that is safe to reduce the stigma of a mental illness and to allow people to feel more open to speak about what is affecting them without being judged. Within this assignment, it was during my grant writing course, so I had to learn how to seek the appropriate request for proposal on RFP and what the differences were with an RFP and an RFA. Also, how imperative it was to read each of the requirements, because if you start creating a grant that isn't going to be sufficient to what the grantors are looking for, then you've wasted so much time and hours that could have been channeled into the right direction. I learned the importance of seeking a grant early on, because there are thousands of people that may be seeking the same grant. So you have to make sure yours is a standout proposal in order to receive the support, funding, and research tools that are needed to create a program that will enhance the health and wellness of a population in your community. There were several essential components that must fit together for a program to ever be even considered. For instance, working with Tips to Wellness, I would be working with human subjects. So I would need to understand how to submit an IRB before the funder would even consider my proposal. Is it going to be safe for the people that are participating? Do I have their consent? Are they informed? Their informed consent is the ultimate piece of clearance that you need to be able to conduct a research program that is going to be successful. You really need to understand what the grantors are looking for in the way of your objectives, because your objectives need to meet their objectives as well. So creating SMART objectives that are specific, measurable, all of the things that are important, accessible, time management, it's all important. While creating Tips to Wellness, I also learned the importance of advocating for our own communities and for the importance of communicating with the key stakeholders. Key stakeholders are the people of our community. They're not necessarily always going to be the governmental leaders. They're going to be the people that we walk on the streets with and who experience the health disparities and the inequalities. Those are the people that need our support as health educators. And throughout these courses, I was able to understand how to channel my focus. I was able to use myself and understand that there are groups of people that just need an opportunity, and that we can definitely change our direction in our career paths. Thank you.
Thank you, Stefanie. We now go to Stefanie Popper.
Hello again, and thank you for affording me the ability to discuss another point of aid and clarity in my growth as a graduate student. As graduate students, or distance learners, we are already embedded in some form of health education or have a definitive career goals and drive or an ambition. For me, I started as a nurse and went into being a nurse educator. And so flowing into becoming a health educator was relatively, not a difficult leap, but learning how to do so and on a graduate level was much different, and was much different from practical application. I had to learn how to do so as a health educator. One of the things that I found very, very important to me in the learning process was time constraints, time management for myself, for getting through the program, for getting through each class, for getting through each assignment. And that helped me when my instructor gave me a timely response to my assignments and my discussion posts. This has always been a key component for every class. However, once I really started understanding how assignments fit into the learning process, and the learning objectives, the instructor response time became more and more valuable. It helped to confirm my thought processes, that they were specific to the assignment, that they were meeting the learning objectives, but more broadly to the class as a whole and my overall learning goals. In one of the classes, one instructor had almost a 24 to 48 hour turnaround time for grading or comment on each assignment. The comments were concise, they were pointed, and provided excellent feedback, not, as one of my fellow students said, just great work, but very pointed and directed. This area needed work, this is where you fell short, this is where you excelled. And the comment boxes on each assignment was very helpful. And again, having them back in a timely manner. Because of the timely response from this particular instructor, I was able to understand when I was going off course. I was able to self-correct on the next assignment and on all the assignments moving forward. Honestly, as a student, it kept me excited to turn in my assignments and to get the instructor feedback, whether they were positive or negative. In one instance, the instructor was well-versed in APA format, and that area is always a challenge for me. It was almost a big barrier for me. And had I not received feedback from this particular instructor in a timely manner, I would have continued submitting papers that were not meeting the standards of APA formatting. And as APA has advanced and changed, I was not keeping up. So my timely responses from my instructor was very, very helpful. And it made those assignments more impactful, more effective, and it made me feel better about the quality of work that I was putting in. Conversely, in a different class, the instructor didn't respond for 1 to 2 weeks or sometimes even longer. Multiple assignments had no grades or no comments, no responses. And truthfully, it left me feeling somewhat untethered and unsure of the direction I was taking. I didn't know if I was on track and meeting the course requirements. Timely instructor responses are very valuable to the learning process for all students, but especially to the graduate student, because we are adjusting our thought processes to grow and to view with the view of implementing our education into real-world application, practice, and career goals. Grant writing was a challenge, but unimaginably successful, in large part to the instructor's prompt, meaningful, and student-specific feedback. The structure of the class, where it step by step took us to developing our end project, and the examples the instructor provided, the clear expectation for the final project, and again, the timely instructor feedback elevated my thought process and the way I approach each assignment. It helped me to stay on track. I really enjoyed the class because it helped me to see myself in my role as a health educator, as a graduate student, and how I can positively affect change moving forward, elevating the community that I serve, the communities that I look forward to serving, and helping to increase their health literacy. So those timely instructor feedback, again, helped me to grow in the way I wrote and in the way that I saw myself and my future career goals. Thank you.
Thank you. And now we go back to Holly.
Hello again. Another assignment that I really want to talk about, I found exceptional and would like to share was one I completed for my health behavior theory class. It was entitled Obesity Among US School Children and the Precede-Proceed Model. For this assignment, the health issue and the target population group were pre-assigned. But what was helpful was that the health behavior theory class was divided into 2-week modules, which allowed for more in-depth assignments due at the end of each module. And I really appreciated having more time to put into an individual assignment. This assignment provided me with an opportunity to do extensive research on the health issue of obesity in school children, and then learn the practical and necessary importance of using the Precede-Proceed model as a framework to lay out the process of designing a participatory socio-ecological intervention program. Using the first 4 phases of the Precede-Proceed model, I focused on the assessment, evaluation of needs and resources, determining influencing factors, looking into policies, regulations, funding, supportive organizations, and then using all this gathered information, including the outcome goals, to outline the design of the intervention. The skills and knowledge I gained doing this project was just unbelievable. I really appreciated this assignment. It's very well designed. And following the Precede-Proceed model, I evaluated and selected the theories that I used, trans-theoretical model and social cognitive theory, combining the two and using those theories and researching existing evidence-based obesity interventions, and then seeing how they fit together and what I could modify to better aid school children in an obesity intervention. I actually outlined how the obesity intervention would be structured, and then completed the remaining 4 phases of the Precede-Proceed model, which it concerns the implementation and evaluation of the intervention, and outlined how that would be deployed and evaluated for success over time, as this would be a long-term intervention. And the approach I used, the Precede-Proceed model is complex, but it's logical in its progression. And the learning resources were critical in helping me to understand the different components of the Precede-Proceed model. They included different sources providing explanations of the Precede-Proceed model from different perspectives. And that was very valuable. And I feel that I got a very good grasp of how to use the model as a framework to guide the intervention process because of the learning resources. And it was also invaluable to read the selected studies from the learning resources that were designed and implemented using the Precede-Proceed model. After thoroughly and repeatedly reading and studying how the Precede-Proceed model was designed to be used, I then began my own outline of an obesity intervention for school children using the Precede-Proceed model. I did a lot of research into the existing interventions, and then using the health behavior theories that I selected to start filling out my outline and moving into detailing the intervention, and then move through the evaluation phases of the model. Through this assignment, I learned that the Precede-Proceed model is a brilliant, versatile, and critical tool for the health educator in all phases of developing a health intervention. This was, again, I can't say it enough, this was an invaluable assignment. The instructor feedback on assignments and discussions leading up to this assignment were also essential. They allowed me to determine whether I was truly understanding how to select and apply a health behavior theory to an actual health issue. and then had the appropriate skills needed to develop an intervention plan. I really appreciated and responded well to the positive feedback approach, and the instructor also, in the feedback in discussions, was really helpful. The instructor asked me to consider additional concepts or approaches, or ask challenging questions about my discussion topic that were also invaluable to keep me moving forward, and pointing out areas for further consideration to help me build the skills to reach the ability to complete this assignment. In regard to feedback for the assignment itself, while I received feedback that I'd done a good job, the piece of feedback on the project that I really want to receive is, what areas can I improve? I do want to hear about my strengths, but what can I improve going forward? Where can I go? What resources would be good for me to read, look at, explore? And I do want to make a special note. Although the learning resources in the health behavior class were relevant and well selected, I want to point out that in some courses, the relevance of learning resources have not always aligned with the current assignment. And my time, I also have a full-time job, so my time is valuable. And if I end up reading a resource article or chapter and have to wonder about how it was related to my learning topic, I feel frustrated that I either missed the point or was given irrelevant material. What would be helpful is for the learning resources with those hidden gems to have a pay a special attention to this point or aspect while reading notation somewhere in the learning resource line. That way I will learn what I'm meant to learn. And I do feel the Precede Proceed assignment, again, was an invaluable learning experience in my goal of becoming a health education specialist. Thank you.
Thank you. And we will now return to Stefanie Bollheimer.
Hello again. Finally, the last two assignments that I will share with you today, they actually worked in tandem. For our final course, the capstone, which is the culmination of all the things you've been working on, you get to put all of your budget skills, your research skills, your planning skills, all together into one large final project. To complete this, we were instructed to seek out and establish a mentorship. I had yet to ever really have an official mentor at that time, so I was not exactly sure how to go about asking someone to step up to the task. Now, mind you, I was working on this course at the peak of the COVID-19 outbreak, so I had the extra layer of fear. How am I going to go out into the community? We're not even allowed to leave our homes. How am I going to go about finding a mentor who is, going to have the time to help me as well? And how could I help them? So after I pondered it for a few days, I decided to utilize some of our digital platforms, and our university had a Facebook page. So I took that to my advantage and I posted a small notation if anybody was willing to speak with me and find out some of the requirements. I actually had quite a few volunteers right off the bat, but ironically enough, it was the very first person that reached out that actually turned out to be the best fit for me. My mentor was someone who had actually just recently embarked on her own career change. She was currently working on her PhD program at the same school that I was going to. And she was able to really relate to me and help me navigate through how to create a strong resume, which was part of the assignment, how to utilize my experiences in my past career and turn them into achievements that would attract a recruiter or a potential job in the health education field. Because as I mentioned before, my biggest barrier was my own lack of experience in the health field. So I felt that, how am I going to say I can do this and this and have an employer want to hire me and give me a chance? So my mentor was actually able to help me break down what I had done and present it in a way that would be appealing. The last assignment was to collect previous projects that we were most proud of and input them into an e-portfolio. I had never heard of an e-portfolio. I guess I'm out of the loop, but I learned, and I actually am so excited that I was able to have this tool. I have it saved to my computer today. It wasn't just an assignment. It was actually something that I will carry with me through my health education career, and I will be able to continually upgrade it and keep it current by adding more achievements, changing out some programs and some focuses. And then you can actually link your e-portfolio to your LinkedIn account or other accounts where employers do seek out new recruits. So having all of these tools to utilize in my future was invaluable to me. Having the mentorship was invaluable to me. I don't know if I would have actually sought one out had it not been assigned. Each of the assignments I mentioned and so many others throughout this course have boosted my knowledge, my self-confidence, and the ability to connect on a personal, professional, and a meaningful level. I will actually use all of these tools in my future, and I will recommend them as I go because I love sharing how awesome it is to continue to learn, and it's something no one can ever take away from you. Thank you.
Thank you. And our last speaker is Holly.
Hello. And lastly, I'd like to talk about yet one more assignment that I enjoyed and found exceptional, which was completed for my health behavior theory class. And the assignment was to select a target population group and a community of my own choice, and along with also being able to choose the specific public health issue to address, and then design an intervention using any health behavior theory or theories that I wanted with no budgetary limits. And a mandate in the assignment to go wild with our intervention. This was a fun assignment. I felt like a kid in a candy store with a platinum credit card and no limit. And once again, I really, really appreciated having the opportunity to choose the community of that was a local community and I had personal attachment to. I created an outline of the project and began by researching the community. The public health issue was cardiovascular disease in a disadvantaged community. The assignment gave us an unlimited budget, so I decided to go big with my choice of health behavior theory to affect change in the entire community, redesign the entire community, including its infrastructure, its policies, organizations, and affecting the residents on all socio-ecological levels of influence. I chose to use the social capital theory combined with the social cognitive theory of health behavior. And I found both of those theories combine really well and developed an intervention to transform the entire community. My approach was to think about and outline how a non-discriminatory community was structured using the social capital theory supported by the social cognitive theory and how it would operate. I found that previous discussion posts that introduced the social capital theory and social cognitive theory on a less grand scale were critical in developing an understanding of how to apply them on a much larger scale and affecting an entire community. I designed this to change a disadvantaged community, created a whole system of social capital, which didn't just use money, it used social capital, and social capital was exchanged between residents for education, employment, programs that help to lead a healthier lifestyle. It was a fabulous learning experience. And again, my approach was to outline the overall project, perform the research that allowed me to stay on track and get this assignment completed on time. And I found the health behavior course to be well designed, introducing new health behavior theories that built in complexity, applied to different health issues every week, building our skills in using these theories. And this was extremely helpful in preparing me for this final assignment. I feel I gained a good understanding of the value and the use of applied health behavior theory and intervention design. And as a final note, I want to highlight again what I found most helpful as a graduate student. The relevance of the learning resources to the learning topic is critical and cannot be overstated. If it is a fairly hidden relevance, then it would be helpful to provide a note indicating what aspect of the learning resource is important to pay attention to. Graduate students don't have a lot of time, so I appreciate the special notation. Positive feedback is invaluable. I want to hear about my strengths and I want to hear about my weaknesses. I would love to hear about suggestions you have for improvement. And I'd like to hear about how to increase my strengths. I do appreciate strict feedback on APA writing style and rules. Multi-part assignments that build into a final project are extremely valuable and provide an opportunity to progressively explore, build, and utilize the complex skills and knowledge needed by a health educator. I appreciate discussion post feedback that asks questions, challenges me to think deeper on a topic. I also want to hear if I'm on topic and have answered the post adequately. And also I have a suggestion in that it would be very beneficial to receive a check-in from an instructor, perhaps at the 1/3 time frame and 2/3 of the way through a course, letting me know if I'm on point with where I should be in my coursework, areas for improvement, and areas that are successful. I believe that all these things are critical in the graduate instruction program. I appreciate the opportunity to share my opinions. Thank you.
And I'd like to thank my 3 graduate students. I'd like to thank Stefanie Bollheimer, Stefanie Popper, and Holly Reese for their invaluable contributions to our session today. Before we began our session, there was no research that had ever been published in the area of graduate student research. And I'm very pleased to say that over the last hour, we have begun those discussions. And in essence, this is a qualitative research study that we have just completed. The future of our health education profession and the future of our health education professional preparation depends upon research in the area of master's and doctoral learning and master's and doctoral learning research. Today, we began that research with these 3 outstanding graduate students. I could not be more pleased and more proud of my 3 graduate students. So with that, we will now open up to any questions from the audience. Again, I'd like to thank you for attending our presentation, and I look forward to the continuing dialogue within our health education and promotion profession and on graduate student learning.